Once a patient has decided that they no longer can live with their disabling pain symptoms with respect to either their neck or their back, then that is when they consider spine surgery. Now, what is important to realize is that there are certain steps involved in spine surgery. Number one, they need to be aware and educated about the preoperative process. They need to know the mechanics of the surgery, and they also need to know the postoperative protocol. In addition to that, it's crucial that they understand the risks and what they're getting themselves in for. Now, once they have a good command of all that information, that optimizes their function postoperatively and their recovery. Just to touch on the risk, it is important for patients that even though these risks are rare after spine surgery and most patients do well, it's critical that they are aware of them so that they can prepare in the event that these happen. Some of the more common spine surgical complications happen to be infection, bleeding, hematoma, some of the which are frequently quickly treated, and some of the more uncommon complications happen to be hardware failure, hardware misplacement, CSF leak, spinal cord or nerve injury, which do require potentially having a subsequent surgery. Now, once they've got through the operative period, then the postoperative period is critically important because they need to follow the recommendations with the lifting, use of the brace, and then once that period is done, in the neck and lumbar spine, I typically do about 6 weeks. Once they've weaned out of the brace for those two parts, then I gradually increase their lifting. And then once that's completed, then we start physical therapy on them. And that whole process optimizes their outcome and enhances their recovery.